All right, so it isn't up there yet. So welcome to this. This is the closing panel, and the discussion's entitled, here we go, Back to the Future, Reinventing Bioinnovation Ecosystems. Now I'm thinking Tony's having a bit of joke, calling it Back to the Future, just thinks I look like Doc Emmett Brown or something. But my name's actually Mike Ward. I'm the global head of Life Sciences and Healthcare Thought Leadership at Clarivate. I don't have business cards because the title's too long. And I've been commenting, writing about the sort of biotech industry since 1984. So actually, first time I came to Babraham, it was that brown building next door and a few porter cabins with some of the early biotechs, and I met a very young Andy Richards. He was very fresh-faced, and also we were both slim at that time. So Tim, in his presentation, he was talking about sort of the state of the capital markets, and again, I've been tracking it for like 3 decades or so. And I can concur that, in fact, while the public markets are a bit difficult at the moment, actually there's still plenty of money going in from venture capital. And that's partly because these guys have raised big funds and they've got to deploy it somewhere. But in the UK, though, I've been sort of capturing the data for the Bioindustry Association, and we do this on a quarterly basis. There is quite a lot of money still going into the UK. And in fact, if you look at where all that money's been attracted, not surprisingly, it's Massachusetts, it's San Francisco, it's San Diego, it's the UK, and more recently, we've also seen mainland China being a pickup. Importantly, though, biotech isn't just about healthcare. It has other applications. In the past 2 decades, advances in the biological sciences, combined with what we heard today, sort of advances in computing, machine learning, data processing, artificial intelligence, have been fueling new waves of innovation in a whole bunch of sectors across the economy. So healthcare, obviously, but then we've also got agriculture, consumer goods, and even energy. So what I thought we'd do in this panel is, given the fact that the life sciences is expected to be a major catalyst for sustainable economic growth, feeding the world, keeping us all well and healthy, etc. And the fact that governments are, therefore, particularly like people like the UK government are, backing this sector. It would be interesting to explore, some of what are the components for a successful ecosystem. So Tim was kind of like showing it somewhere, and also to discuss how it's going to evolve in the coming years. So this is my panel, and what I'm going to do is I was going to do it in alphabetical order, but you're not sitting in alphabetical order. So what I'll do is I'll go from my far left, your far right. Tim Schoen, CEO of BioMed Realty. You've just heard him speak. Next to him is Wael Muselmani, who's a business development lead at MedCity. Next to Wael is Andy Neely, who's Pro-Vice Chancellor, Enterprise and Business Relations at the University of Cambridge. Next to Andy is Belinda Clarke, who is the Director of Agri-TechE. And finally, we have James Fry, who's Partner and Head of Life Sciences at Mills and Reeve. So, to kick off the discussion, I'm actually going to ask each of the panelists, and we can do it in the reverse order, to introduce yourselves, the organisation that you represent, and also the role that it has in this bioinnovation ecosystem. So, James, if you could kick off for me.
Yeah, I'll start, Mike. No, thank you for that intro. So, I'm James Fry. I'm a partner at the law firm Mills and Reeve, and I also head the firm's life sciences practice. And so part of the cohort of professional services providers locally within this cluster. But we also have offices around the country, so co-located with other clusters such as in Oxford and London and Manchester, Audley Park. So I think we'll come back to actually the role that professional services firms play within the community, and that's how I regard things. It is a community, and it's great. I felt the buzz around the various rooms today, and it's just been great for everyone to be back in such a supportive cluster. But part of that community, hopefully part of the glue. But I think we'll come back to some of those points a bit later on.
Sure, thanks. Belinda.
So I'm Belinda Clarke, and I'm the founding director of Agri-TechE. We used to be known as Agri-Tech East when we were sort of geographically constrained to the east of England. I could bore you for the rest of the afternoon on why we rebranded to Agri-TechE, but it was around really this transition into an innovation ecosystem. So we bring together farmers and growers with technology developers, researchers, the innovators that are developing new tools, services and practices for farms, but also that wider ecosystem of the commercial and technical service providers, policy, funders, investors, entrepreneurs. So we, I guess, provide the soft infrastructure, if you like. We don't have facilities. There are other organisations that have facilities and equipment that innovators can use. We are entirely virtual but omnipresent. So I guess our role is really helping to connect up that innovation ecosystem from, and I promise this is the last time I'll use this phrase, farm to fork.
Andy.
Afternoon. So my name's Andy Neely. I'm the Pro Vice Chancellor for Enterprise and Business Relations at the University of Cambridge. So what that means, for those that don't know what a Pro Vice Chancellor does, the structure of the university, we have the Vice Chancellor and then 5 Pro Vice Chancellors. Each of us look after big chunks of the university. So one looks after all of education, one looks after research. I basically look after everything to do with innovation, commercialisation, startups, spin-outs and links with business. We'll talk more about what goes into the ecosystem in due course. Just a few facts and figures about the university: 20,000 students, 15,000 staff, about 150 departments and institutes, 31 independent colleges that are all charities in their own right, and lots of people doing research and education in areas to do with life sciences.
Hi all, I am Wael Muselmani, Business Development Lead at MedCity. So MedCity is the cluster organizations for London's life sciences sector. Basically what we do, we are a not-for-profit organization set by Mayor of London in 2014 and by the Academic Health Science Centres in London. What we do is like to try to connect and convene and catalyze the innovation in London. So we like supercharge innovation and investment in London life science sector. We do that by connecting industries with research institutes, investors, real estate developers, regulators, and all the stakeholders of life sciences.
Tim.
You heard it, the BioMed Realty. We operate 20 million feet. I won't make you listen to it again.
Right, okay. Just want to check, could everybody hear the panelists? Excellent, okay, because we just know that sometimes there's can be a problem with the AV. Tim, I'm going to start with you. So in your introductory remarks, you talked about sort of the work that BioMed Realty does, and it's not surprising that the sort of the places you're in are the sort of where the life sciences clusters are. You have Massachusetts, San Francisco, San Diego, Cambridge, or the Golden Triangle because it's Cambridge, Oxford, London, but. And I was just sort of wondering, when you decide, what you're actually going to invest in, what is it you need to see that sort of in those places that actually is going to sort of say that yes, this is where we're going to plant our flag if you brought it with you.
The 4 things we look at, it's interesting because people talk about an ecosystem all the time and what does it mean. We sort of break it down, and I talked a little bit about, I use Boston as an example. We talk about MIT or Harvard. You've got to have a research institution. I was in healthcare real estate before. You wanted to be in the shadow of a hospital if you own medical office buildings. Here you want to be in the shadow of a world-class research institution. So you've got to have the research institutions. And then you've got to have the commercialization of some of the technology that the tech transfer groups from MIT, Harvard, Cal, UCL here in the UK are trying to spin out the technology. So you have to have the business aspect of it. Then you have to have the capital. You have the venture capital that we talked a little bit about, and like Arch Ventures, I mentioned, just raised $3 billion. Those three things. And then I think the other thing you have to have, in fact, we know you have to have, is the infrastructure. We spent a lot of time in the US talking about infrastructure bills. Well, the life science infrastructure and what we build, if you have those four components or those four legs to the stool, that's what the ecosystem is. They all speak their own language, but when they get together, it's super powerful. And you have that in these markets. And we went into Boulder, Colorado, which I don't know how many folks have been to Boulder, Colorado, but it had all of those elements. It had a research institution at the University of Colorado Boulder. It had VCs. It had the commercialization of drugs. And the one other component I would add that we've seen, which I think is the most powerful force in business today, which is the confluence between tech and science. So if I could add a fifth, I would add that as well. Those are the five things that you look for. And when you have that, that makes up an ecosystem.
Right. Okay. And we'll come back to that sort of like convergence or that confluence of the two. Andy, so it was mentioned, sort of like research institutes, etc. And frankly, every time Steve Bates, who's the CEO of the UK Bioindustry Association, and also cheerleader in chief for the UK life sciences. One of the things that he highlights is the fact that here in the UK we've got as Tim pointed out some of the world's leading universities in the life sciences. In your introduction, you kind of sort of said that that's your responsibility. So I'd love to sort of hear how the sort of the relationship between Cambridge and commercial biotech has evolved, say in recent times, and how you see its role in what is this golden triangle biocluster that we have here.
Yeah, and I'll build a bit on the description of the ecosystem because when I came into post, I looked at what was going on across both the university and the wider city of Cambridge. And there are, depends on how you count them, but about 40 odd initiatives supporting innovation, commercialisation, not all devoted to life sciences, there's some in the tech space as well. And at first sight, if you just look at this and you think, what on earth is going on? It's just, in fact, some people describe it as a bit of a jungle. I don't think that's the right description. I think there's an organising structure to this. So for me, I buy the argument about research institutes, but actually I broaden it to knowledge engines. I think if I look at Cambridge as a city rather than just a university, clearly there are lots of interesting research institutes within the university and associated with it. There's the Wellcome Genome Campus, LMB and so on. But actually in some of the local businesses, there are loads of people in local businesses who are coming up with really interesting ideas and saying we're going to launch something. And there are spin-outs from AZ and a whole host of places. So the first sort of foundation for me is a knowledge engine. Absolutely agree. The first pillar for me is about support. And by that, I think of both IP, professional services, and the finance piece. So if you think about the university's role here, we have a tech transfer office, Cambridge Enterprise. If somebody comes up with interesting IP, they'll go to Cambridge Enterprise. CE will help protect the IP, they'll patent it if that's the right thing to do, they'll help do a licensing deal, they can invest in startups with seed funds. CE's capped and can only invest up to about 3 million, at which point it stops. We set up Cambridge Innovation Capital, so the university owned a third of CIC, and part of the reason for doing that was to get more Series A, Series B capital in the ecosystem. There are other sources of capital, so there's Cambridge Angels, there's Amadeus, there's a whole host of things going on, but that's the first pillar. Second pillar is the space one, and I think the way you described it, Tim's absolutely right. There's a range of spaces from the very early startup space. We've got Ideas Factory, Eagle Labs, linked to Barclays Bank, and then as you grow, you might go to St John's or the Bradfield Centre and take modular office space. And then you graduate and you come to a bigger room. You may, if you want life sciences, you might come to Babraham because there's space down here. Well, sometimes there's space down here. I think it's quite full at the moment. So that's the second pillar. The third one is skills. And I think a really fundamental thing when I look across the university is the amount of education that goes on around supporting people to develop entrepreneurial skills. And it's not just the tech skills, it's also the commercial skills growing the businesses. But then the thing that I think is really important about Cambridge particularly is across the top of this, if you imagine the knowledge engine, the base 3 vertical pillars, across the top I think of connected Cambridge. And that's all the networks that exist. So One Nucleus, fantastic example. If you're into life sciences, healthcare, you join One Nucleus. If you're into sensors and IoT, you join Cambridge Wireless. If you're if you're an entrepreneurial postdoc, we've got 5,000 postdocs in the university. They're not all going to go to faculty positions. If you're an entrepreneurial postdoc, you join EPOC, entrepreneurial postdocs at Cambridge, because that's where all the entrepreneurial postdocs hang out. And then, of course, there are people that straddle those networks. So it's incredibly easy in somewhere like Cambridge. Andy Richards, you mentioned earlier, it's incredibly easy to get hold of people because they're all both networked through those professional associations, but also the size of the city means that people bump into each other. So I mentioned Andy because the reason I met Andy was that his daughter and my daughter were in the same class at school. We didn't know what each other did, and we chatted in the playground a bit and then worked out what we were doing. And that close set of connections in a city where people are incredibly generous with their time means it becomes really easy if you've got a neat idea to get access to the right space, access to the capital, et cetera, and the skills. And so I think that's how the ecosystem works. I use the jungle analogy and to a certain extent the role the university is playing because some people describe it as a jungle, it's a random thing, people just set stuff up left, right and centre. I don't think that's the case. I think a much better analogy is a garden, and that actually what we should be doing, a bit like with a garden, it's not an engineering system, you don't design ecosystems in a really structured way, but equally you don't just let them completely grow randomly. In a garden, you decide where to weed, you decide where to put a bit of fertiliser, you decide where to plant things. It's still a living system, you're not going to control it completely, but you deliberately nudge it in particular directions. And I think that's one of the roles that increasingly is happening in Cambridge. People are looking at the ecosystem and saying, right, we need a bit more capital. We're worried about not Series A capital, but the large-scale growth capital. People often go to the US. We need a bit more prototyping type funding. Where do we get that? We need more wet lab space. How do we encourage that to be built in the ecosystem? So that's the sort of model that I think collectively people are using, and certainly within the university we're looking at and thinking, where do we invest?
Right, yeah. So, that garden analogy, I'm just thinking of Tony being the Alan Titchmarsh of biotech. So one of the things, so this again is a question to Andy, but maybe some of the other guys would like to sort of jump in as well. So during the day, we've sort of had a lot of, sort of your conversation about sort of the various technologies, and you're sort of bringing people together and sort of the necessity of collaboration. So I was just sort of wondering, what role does, say, for example, a place like Cambridge, where you have these students, how do you help them sort of learn the sort of all the different skills? I mean, you mentioned it, but I was just sort of thinking like the idea of tech people being able to talk to life sciences people, and then even in the life sciences, biologists and chemists, completely two sort of like different species almost. So I just sort of wonder, is there something that is actually happening in academia now to almost sort of make people more like polymaths around this space where we need this convergence of ideas?
Yeah, there is. So one of the things people often talk about is T-shaped people, where you've got deep depth in particular areas, but you've also got that breadth to be able to connect off across to other people. So if you look at some of the master's programs, increasingly they're combining things like bio and management skills or business skills. If you look at some of the courses that the business school runs, so the Accelerate program, increasingly that's trying to bring together technologists with people that might be involved in life sciences. I think there are other bits to the structure as well, though. So if you look at the CIC portfolio, so I sit on the board of CIC, and the portfolio of firms there, about 30, well, now close to 40 actually, firms in the portfolio, but it's roughly 50-50 between deep tech and life sciences. And that's a new model for venture capital firms. Often you find venture capital focusing more on tech or life sciences, but deliberately in CIC we're trying to straddle both, and it's partly the convergence of the two. And then I think the other interesting thing here is the way the city's evolving. So if you look around the south of the city, the biomedical campus, down to Babraham, that's clearly a sort of really strong life sciences cluster. If you look at the west of the city, that's a big development space for the university engineering. The whole of engineering will move out there. That's where the computer lab is. That's where the new Cavendish building is and so on. That's sort of tech space. And then around the station, increasingly, is becoming the kind of AI, machine learning, so Microsoft there, Samsung there, Apple there, a whole host of the tech type companies. One of the things we're going to have to get right in the city is how we get the connections between those different spaces so that we don't end up with just life science going on the CBC south end of the city over to Babraham, and then the deep tech stuff happening around the station. And virtual platforms are getting launched there. So Health Tech Connect was launched recently by the Milner Institute and CATS, the Cambridge Academy of Therapeutic Sciences, and that's an online platform, basically a nurtured community or a developed community for people to both connect into the university and the researches that are going on, but also the university to connect out to people across those communities.
Right. And while I mean, sort of, at MedCity, you've kind of got that sort of like coordinating role, within London, where you're trying to bring lots and lots of different stakeholders, whether it's sort of, academics, companies, I guess the finance community, regulators. How are you sort of, sort of almost like, helping sort of like nurture that sort of cross communication, that crosstalk?
Yeah, actually there are quite a few of challenges like doing that and aligning all the aspirations. But I would like to highlight like one point that one of our roles like to help the SMEs to find the right R&D space. And we find that there is like a chronic lack in lab supply in London. So we performed like a life sciences real estate study, and we published that a few months ago. We noticed that there are like, from 2016 to 2021, there are like 4-fold increase in the lab demand. And in a recent published report in 2022, it's noticed that the new startups are preferring to locate in London. So there is like about 43% increase over 1 year of life sciences startups in London. So there is like a demand for the lab, and companies are not funding that lab easily. So we have set and established a lab providers forum, connecting all the lab providers in London, trying to like knowledge exchange and to track the lab supply in the area. And we set like kind of one shop for like on one page in our website for the companies to have an idea about all what's happening in the area, all the lab supply, what's going on, what's in the pipeline, where can we locate. The other thing that I would like to highlight that, as you said, like it's kind of the aspirations are different. So sometimes the lab providers are struggling to getting planning permissions from the local authorities. So we also highlighted for the local authorities what the life sciences clusters can bring to the local community for benefits and like that. So we published another report focusing on cluster and community dynamics, highlighting what kind of benefits that the local community can get in terms of like job creation. It's not like just life sciences. When you have one job for life sciences, you will create more like indirect jobs and induced jobs from the lab supply chain and from like amenities and other things that will be created. We also highlighted how can, by creating life science clusters, develop the talents and the educations by collaborating with schools and universities, having apprenticeships and like internships in those life science clusters. We also highlighted the other parts, how we can improve the healthcare of the local community when it's like a cluster within a local area, and how the placemaking should be made in order to have the places, and you probably know more about that, to let the local community have access to those places, have kind of exhibitions, to let people educated and get more knowledge about what life sciences in order to prepare the next generation for hopefully be the next
So what would you say is the most difficult of all those elements that you're trying to bring together? You know,
Yeah, like
is it a group that you have to convince?
Yeah, like for example, the planning teams in local authorities, they are not, for example, prioritizing the life sciences. They look at the whole community. How can we improve the economy? So with this kind of roundtable discussion that we hold with them and kind of reports, we show that it's not just life sciences. You can reflect that on other sectors for the local community. This kind of stuff.
So Tim, how does that sort of reflect, sort of the other sort of clusters that you operate in? Are you hearing sort of similar sort of messages and challenges and other sort of elements of best practice that we could clone?
Yeah, I think, I mean, you talked about the early part of the space, right, or early startups. I think there's a critical lack in all the markets. There's never enough. And it's hard to run those because they take a tremendous amount of management time. But in all the markets, we see a lack of incubator space. Although the encouraging part of is there's groups like MedCity, there's groups like Smart Labs, Cambridge Biolabs. There's groups that are out there that are actually focused on helping provide that infrastructure and help provide the space and the services, not just the infrastructure, but the services, so that they don't have to hire everything and bring everything in-house. They can use their capital to focus on the research.
Yeah, the good thing is that there are also more development in the pipeline. The lab providers are realizing there is a huge demand, so a lot of spaces will be provided within the next 2 years. So that's a good news for the sector in London.
Yeah. So James, you work for a law firm and you're part of that that professional services crowd that are very much supportive of companies. I just wonder if you could explain the kind of role that you have both in the creation and the maintenance of, for example, the bio innovation ecosystem. And can you give us some specific real world examples of where you've made a difference?
Yeah, no, absolutely. I think in terms of the other elements of what makes a biocluster, it's also about network and connectivity, and that's both connectivity internally within the cluster in terms of, I'm sure we'll get on to tech bio and how life sciences and tech networks work more effectively together, but it's also connectivity beyond the cluster with other clusters within the UK, but also in Europe and the US. So if you look at the role of I'm not going to talk about a law firm per se, professional services firms, and we obviously have a cohort of those within the city. Clearly, we provide the legal and professional support to those businesses, but I think one of the key things is about being able to support businesses as a cohort right from start-up, from spin-out, all the way up to unicorn. So having that array of services that can be delivered locally. So that's the first element. The second element is around law firms, accountancy firms are very, very broad churches. I mean, we're a firm of about 1,250 people nationally. We're not all life sciences lawyers. We have a thriving life sciences practice, but what we're able to do is to connect into other areas. So I'm sure we'll come on to some of the overlapping areas like Agri-TechE, like tech, and clearly the professional services community can help businesses with the challenges around that in terms of pivoting their businesses, pivoting their platforms. I suppose the last area is around network. So I mean that's a way. In many ways, I talk about sort of the magic sauce. We've got large established networks, so the ability to be able to plug in other advisors. A client needs an advisor in quite a niche area, whether that's on the regulatory side or another. We've got that network, as will other professional services firms, to be able to sort of plug in people who we know and trust and can do a good job. but also on the investor side as well. So we do a lot of that in terms of almost sort of brokering those discussions between our clients looking for finance and investors, and those investors may be within the UK, and they may be overseas as well. So I think that's it, Mike. It's about that broad provision that's adaptable, and I think the other area around what makes a great biosystem is the ability. I love the analogy of Tony in the garden, but it's not. I think it's more than that. It's also the ability to adapt as a cluster to meet sort of differing technology trends, areas as you go forward. So that adaptability, I think, is absolutely key.
Yeah, I mean, it's an interesting one. I never sort of thought of actually how lawyers have got more a catalytic role in that cross-fertilization of the various, so almost like accidental collisions from different
absolutely.
tech areas at your offices as they're all waiting with their coffees. So, Belinda, in your introduction, you sort of mentioned the fact that Agri-TechE is an organisation very much focused on the sort of the agro space, and farmers, right? The sort of don't necessarily come across as like the most innovative, right, in terms of like your high tech, etc.
Hold my gin.
Well, we can sort of see, for example, and it was in collaboration with, for example, the public that the first wave of innovation associated with the life sciences was, around GMO crops, etc. And that just didn't take off in Europe at all. There was resistance from a whole bunch of fronts. So I just sort of wonder, what is it that your organisation is doing to actually engage and bring those farmers and actually getting them part of an innovative ecosystem?
Yeah. So I've spent a lot of time reflecting on the difference between the industry of pharma with a PH, which I spend a lot of time thinking about, used to work at One Nucleus, and then pharma with an F. And the route to market and the shape and dynamic of the industry is, you're absolutely right, very different. It's very fragmented, and farming is a very heterogeneous community. There's a classic bell curve of the early adopters and the innovators and the laggards and those who still do it the way dad and granddad did it. And because it is always the males usually at this stage who did it. So I spend a lot of time thinking about this, and I'm really taken with Tim's comment about being in the shadow of a hospital, because we have had a lot of examples in the early days of innovators, and actually it still happens annoyingly, innovators operating completely in isolation and then coming to us and say, here's our thing, can you introduce us to some farmers who'll buy it? And we've now created a program called the Pharma First Innovation Group, which is a safe space for technology developers and researchers to say, how would this look? Would you put it on a quad bike? Would you put it on a tractor? How do you use satellite technology? Which is the farm management software you use? So they get that intel, and there's this overused phrase, but this kind of co-development relationship. And I think it's really important that having farmers front and center of that conversation in the bioeconomy. And I do have to push back a little bit on farmers not being innovative, because actually they're constantly experimenting, because as an arable farmer, you get 50 chances in your career to get it right. So actually you're always looking for ways that you can improve on last year. Your whole annual income is going to reside on a harvest. So there is an enormous appetite for innovation, but obviously what we need to do is de-risk that by peer-to-peer learning. And I just wanted to pick up on something that James said, that the role of the professional service providers in an ecosystem, and indeed the technical ones, for farmers are really critical, because they are what we call the force multipliers. So if you have a very trusted vet or agronomist or land agent who can sit in front of you and say, have you heard about this new technology? They're using satellites to map yield potential of field. Oh, I didn't know that. I'll have a look at these guys. They then go on to another farm and have that conversation, and the farmers talk to each other. So actually I think the role in agri-tech of the professional and technical service providers is almost more critical, because the farmers tend to hear about research and say, when am I going to get it? And obviously they understand that there's a long lead time, but it's slightly different in the pharma with a PH because the business model isn't necessarily around licensing. It is to some extent and development. It's much more about I want to sell to farmers. What's the route to market? Do I join the NFU? Will they introduce me to farmers? And it is a very different dynamic. And I can talk about the GM debacle at length, but I won't bore everybody other than to say there's a new genomic technologies, brackets, precision breeding, close brackets, Bill, I hope you're keeping up at the back, around gene editing and its accelerated use in the UK, which was a journey that the UK was on pre-Brexit and is faster post-Brexit. So watch this space.
So I must admit, all my knowledge about farming is listening to the Archers every day, and I've never heard Tony Archer ever mention gene editing. So that
he did mention robotic milking, though.
Yes.
Yeah. Okay.
Missed that episode.
I missed that episode. Anyway, so, but how do you sort of engage? Because farmers are often they're kind of almost like sole traders. Mm-hmm. Okay, so in an ecosystem, there's lots and lots and lots of different players. For something that is so individualistic, how do you ensure that you get engagement from all the potential stakeholders?
Yeah, and it's around building that community, building the trust. I mean, we've spent 8 years doing it, and the first day in my job, the NFU said, how are you going to meet all our members? How are you going to persuade all our members? And I said, I'm not even going to try. We actually work with the early adopters, the laggards, and one thing that, again, is different to Pharma with a PH, there's an ongoing question, do we make the top 10% of the industry even better, even more efficient, even more profitable? Or do we make the bottom 50% a bit less rubbish? And that's an ongoing conversation in terms of UK PLC. What does this actually mean? And those top 10% are the ones that are engaged in the ecosystem. They are, a lot of them also are not necessarily, they might be generational farmers, but a lot will have gone away and done a different job and are coming back with a clean slate saying, don't care how dad did it, we're now going to look at an innovative approach to managing this business. And there are so many parallels, and I would love to maybe talk to Tony about having a conversation and an event around drawing together the parallels, compare and contrast almost, because the convergence of the industry with healthcare, I mean vertical farming and nutraceuticals and medicinal crops, we need to talk more.
Yeah. I think there's also something on just picking up on the professional services and in the farming world, the technical providers, the equipment providers. So I did some work with John Deere for a while, and when you think about innovation there, so John Deere typically sold bits of kit and they made their money by repairing the kit when it broke down. That's not really a good deal for the farmer if you say, I'll make money when your kit breaks down. So they shift their business model. They start to say, we'll use satellite technology to monitor where bits of kit are in the field. So now on the back of the harvesting implement, for example, there's GPS tracking. They therefore know where it is in the fields. In the olden days, what you used to do is plough the field or harvest the field, turn around and go back up and leave a 10% overlap in the track you took, because you need to make sure you get everything out of the ground because it's about the efficiency of the yield. But if you know the GPS position of the implement that's doing the harvesting, you don't need to leave the 10% overlap, so you can improve the productivity of harvesting the field. If you then connect the GPS system to autonomous drive, the farmer doesn't even need to be driving the tractor. They can be on the stock market working out the futures options on the grain, and it's a completely different world. So there are some really interesting models of really quite innovative technologies and fundamental changes to the business model. And the advantage of the kit providers is of course, they deal with all the different farmers. Now, that's often in larger scale farms, not necessarily in the smaller ones we've got here.
Right. Yeah, I'm trying to sort of think, so like, farmers, are they consumers or are they producers? Or are they both?
The existential question facing Agri-Tech.
But when we come to, say, for example, in the sort of healthcare space, okay, so and we've talked about, some of the stakeholders. There's, what is the role of, in an ecosystem? And because one of the things, again, Steve Bates talks about is the fact that we have the National Health Service here, and therefore there is that sort of connectivity. People all have their sort of, unify, unique identifier within the NHS. I just sort of think, is there a role in the ecosystem for patients, and what should be done to encourage that if that is the case? So who wants to have a shot at that? James, you're
I was nodding away. Yes.
Yeah,
So I make 2 points. I mean, obviously the NHS is a differentiator for the UK, particularly around development of new technologies, new treatments. That's on the one side. But actually, in terms of engaging with patients, I think the medical research charities have a key role to play in that, because they have for many years worked at establishing those patient groups. Because I think you need to engage in a coordinated way, so you're actually getting really rich data from those patient groups. But I do think the medical research charities have a key role to play in that. And I suppose within the UK, you have people like AMRC who actually sort of sit above that in terms of all the different disease areas. So that's how I would see engagement with patients working.
A while.
Yeah, I think there is a role for patients, and there is actually a desire from the government for all the races, genders, geographical area to be represented well in clinical trials, because there are always subcategories that are underrepresented. So, and it's been reporting that when the patients engage more, the impact on their health will be beneficial, of course. So I think it would be good to use technologies to make it easier for patients to be engaged, like digital trials or use telehealth. And also, if we can provide the patients with access to their health records and treatments, that also let them feel more engaged, and then promote the community engagement in clinical trials, tests, and therapeutics. That all would be actually great. And there is a case that I would like to mention, the biobanks. There's Bart's Health Biobanks in Whitechapel, East London. There's more than 1 million participants. So they provide their samples, and then a study is focused on those local communities, because, for example, in this area, the local communities has diabetes. Some people from Pakistani British or Bangladeshi British has diabetes more than others. So when they are feeling engaged, providing their samples to study the biomarkers that are differentiated from other people's, that would be reflect back to the whole health and wealth of the community.
So Belinda, and then Andy, I think you've got a point, and then I want to ask Tim, sort of, is this something that is unique to the UK that is therefore a potential USP? But Belinda first.
I just want to talk a little bit about stratification and this understanding, and I think what patient stratification is enabling is a change in mindset that one size doesn't fit all, one drug doesn't fit all. And sorry to keep wanging on about agriculture, but we're also now being inspired by that to move towards per plant and per animal farming as well. So there's an awful lot that having the patient engagement can also then spill over into other sectors by understanding the segments that you're dealing with. And I think that's critical for success of uptake of the technology.
Mm.
So two quick local examples on this. So we've got in this region Cambridge University Health Partners. That brings together Addenbrooke's, Royal Papworth, Huntingdon, the University, Cambridge University, Anglia-Ruskin University. And that's all about coordinating across the system. Actually, AZ's involved in it as well. And one of the discussions we are having, and indeed working on, is across the eastern region, there are 5 million patients. That's a fantastic resource for research, for clinical trials, etc., etc. But I mean, there's all the challenges around access and ethics around using some of that data. The other thing, really very local example, is through COVID. And you think about the way that this region, because of the genome sequencing capability that existed, one of the reasons the UK was so good at spotting new variants of COVID was because when we were doing testing on the Cambridge Biomedical Campus, and indeed in the other lighthouse labs around the UK, the positive plates were shipped over here so that we could do the genome sequencing to spot new variants of COVID coming as they spread across the UK, basically. So a fantastic local capability of using really important data and actually some really quite interesting research ideas that came out of that as well.
Right. So Tim, so sort of say, when one looks at what's here in the UK, is this something that it's unique within the sort of the portfolio that you've got?
Yeah, I don't think it's unique, but the bench to bedside, right? To have that strong clinical aspect, to be able to get it into clinical trials or into different subgroups is extremely important. Then you see that in different forms and different variations, in different expertise, different types of science, where Seattle may be very good in one aspect, but they all have a clinical aspect to them and an ability to go and have a clinical trial that's close to it and be able to observe the clinical results.
Yeah. So I kind of recognize what the time is, but I'm going to nick 15 minutes because you stole 15 minutes from me earlier on, Tony. But also, I just want to... Exactly. But if anybody's got any questions, put your hand up, and if I don't see it, I'm sure somebody will point out that somebody's got a hand up for questions. I just want us to come back to this, the sort of the confluence between tech and the life sciences, and I'm sort of thinking that maybe there should be a pub in the middle somewhere that they can all meet up. But I just sort of because clearly sort of data handling is becoming really, really important, and we've heard a lot about the sort of potential for artificial intelligence and machine learning. I just wonder if more can be done to actually get these two tribes to communicate, not necessarily just at the university, but actually within the ecosystem, because they're probably operating in two different ponds, and maybe we should connect. So in London, right, you've got this sort of that tech place, as well as obviously MedCity. So what are you doing there in London?
Actually, we're trying to accelerate the innovations of SMEs that have an AI technology by trying to connect them with some research institutes that can apply their results in a lab to see if that makes sense for drug discovery, for this kind of stuff. So we make partnerships. And I would like to share that there is actually collaborations happening between these two types of sectors. Yesterday it was announced by the Francis Crick Institute that they have joint forces with DeepMind. And for you who don't know, DeepMind is an AI company based in London. In 2020, they solved a long-standing biological problem, which is how the proteins fold into the 3D structure. And previously, researchers were, if they want to identify protein 3D structure, we need to 3-4 years of experiments to try to get a crystals of protein, use some experimental approach, X-ray crystallography, this kind of stuff. So it's wasting time and taking a lot of money to spend. So they developed this kind of system called AlphaFold, which solved that problem, and they published the predicted structures of the whole human proteome, which is was a huge leap in the biology. So yesterday they announced they joined forces with Francis Crick Institute, and they are establishing a wet laboratory in the Francis Crick Institute to validate the kind of the results that they get from AI, and to get the benefits from the expertise in the Crick Institute in terms of health and biology and disease. So there are kind of collaboration that's happening that hopefully will bring fruitful results in the near future.
Right. So earlier today, again in some of the presentations, we had mentions companies like Rolls-Royce and Amazon, non-traditional. We had McLaren. We're going to, although they make fast cars, they were also going to make fast ventilators, etc. And I just sort of wonder, are there are there sort of stakeholders from non-traditional areas that could have sort of an impact or could enhance the ecosystem? I mean, I'm going to throw that out. It's obviously a tricky question. So, is there somebody we haven't talked about that we should invite to the party?
Jeff Bezos. I mean, look at Altos Labs, right? I mean, if you look at, they've raised billions and billions of dollars. Altos is here. I mean, that's a good example. Look at Google and Verily. Verily is a life science, arm of Google. So, but if you think about it, those are non-traditional players for sure.
So, well, actually, kind of comes to the point. I remember this sort of like, not so long ago, one of the Genesis meetings, I was like, when I say about 7 years ago, so making a prediction that the disruptors in the healthcare space were going to be the Amazons, the Apples, the Googles. They haven't quite got there yet, but it's close. Angela?
Yeah, same. I mean, we actually have Amazon speaking at our Agri-TechE conference in November because it is so important to see how these other companies, I mean, Airbus have got 11 agronomists. So they are now delivering a huge Earth observation solution. And I think we're certainly thinking that the traditional players that you might have thought about for our industry will still continue to be there, but there's a lot of other companies and other sectors now leaning in, going, we think there might be something in this, delete as applicable, healthcare / agriculture, whatever it might be. How do we get in there? What's the route to market? How can we form these partnerships? So I think our role as kind of ecosystem enablers is to provide a soft landing. How can they get into these industries? Who do they need to work with in order to ensure that their technologies, which let's face it, have been validated in other sectors, we know they work, bring them in, provide a warm welcome. And I think that's the trick for us collectively as those ecosystem enablers.
Yeah, sorry.
I was reflecting on that bit of the conversation, but also something Andy mentioned about how you met Andy Richards. Because I think we talked about how do we get tech and life sciences and agri-tech people and Rolls-Royce engineer type people talking to each other. Actually, when you look at Cambridge, and you see it in the other Cambridge, you see it in San Diego, it's the density of people in innovation, whether they're in different fields. And it's the social interactions, whether it's in the gym, it's in the school playground, it's in the cafes, which is much harder to see how that happens in larger cities like London, Tokyo, New York. And I kind of think, will innovation in the ecosystems of the future, will it still rely on that physical contact sport bit? Or is the next generation going to be more in the virtual world and actually the real location is going to be different in terms of its impact?
And I wonder whether a lot of this will sort of happen almost by evolution, because if you look at a tech bio business, you've got your biologists, you've got your software programmers, you've got your AI specialists, your data specialists, your bioinformaticians. So actually they're having to, on a day-to-day basis, work together to drive that collaboration. I think one of the challenges within tech bio in particular is actually how you break down that silo, different ways of working, different ways of development. But I do wonder whether the drive on the tech bio side is actually going to accelerate a lot of that innovation across different sectors.
Andy?
So I think you raised a really interesting question. I mean, for a long time, people have talked about the death of distance and how it won't matter with technology. If you think about what we've all lived through, I mean, my observation on the pandemic and the way we've all used Zoom and Teams is increasingly we're starting to think more carefully about what those different technologies are useful for. So certainly a lot of the meetings I have these days, when they're on Teams or Zoom, they are much more transactional, much more focused, often shorter. You don't really have the serendipitous conversation. Whereas when people who are based in Cambridge, for example, I think there's an issue actually about the size. I'm not quite sure how you replicate this in London other than think about smaller bits of London. The thing about Cambridge is if I walk along King's Parade, 70% of the time I'll meet someone I know. And bump into them. You have a quick conversation about something, and then you'll meet somebody else a bit further down the road. And those chance encounters, you don't have the same thing when you've got a bigger physical space that people are moving in. So I think there is something about the serendipitous interactions that happen in those small enclosed spaces. I think there is something, as a point you raised earlier about the legal or the professional services firms, it's then how you get different clusters to interact with one another. And so how does Cambridge interact with what's going on in Manchester, or and how you might encourage those encounters to happen? And some of that you may rely on technology for. But I think we'll end up with a mixture. The other bit I would say is, I think one of the things that we've got, and this is a university perspective, but one of the things that's really powerful in the university is the college system, because most faculty have a position in the department, but also have a position in the college. So I'm a fellow at Sydney Sussex College. When I go into Sydney, I never know quite who I'm going to bump into. And I might be sitting by a historian or a physicist or a sociologist or a medic, and you never quite know where the conversation's going to go. And that helps with the cross-disciplinary interactions. In most other universities and most other research institutes, people sit in their departments and they're really specialists in their department, and you're constantly trying to say, how do I get the physicists to talk to the chemists? And there's not some natural way of making that happen almost by accident. I think that's a real strength of the structure we've got around collegiate Cambridge.
Yeah, that's a good point. Although I noticed that when you were talking about sort of mixing, it was Cambridge and Manchester. You didn't mention Oxford. But maybe that was just a
Deliberately,
too far.
Of course,
Yeah.
deliberately.
So a question over there.
Yes, thank you very much. I think one of the rare kind of edges of Cambridge is that we have tech and life science here. And in '99, in O2H, we started a tech company. Later on, we started a life science company. In 2013, we also, like you, saw that the emergence of this was going to be very important. So we set up the Mill Sci Tech Park. We do an influencer boot camp, both in kind of tech and life sciences. And to take up your point about the pub thing, we're on October the 14th, we're doing a kind of where life science meets tech kind of lunch. We'll be doing that in the Mill Sci Tech Park. It's an open invitation to anybody who wants to participate. I'm sure we can arrange some beer as well over lunchtime, rather than maybe an evening thing. But October the 14th. So yes, there is a social event. And all of the panel and all of you can welcome to join in. And we're looking to kind of continue this journey towards kind of integrating these two amazing edges of Cambridge, the tech world and the life science world, ongoing into the future.
So beer always allows the accidental collisions. I know you stood there. And I did ask for an extra quarter of an hour, which I've got another 2 minutes. But yeah, I've still got some questions. Michael.
Thank you. One of the ways to trigger more interaction is to lead with the notion of a problem to be solved. And so I used to work for a company called BTG, and we had a life sciences and a physical sciences division, and it was amazing how little crosstalk there was. Yeah. We were all on the same floor. There were 70 people in that space. And not only were there no conversations, people used to email each other rather than get up and walk across and talk to each other. That's another matter. But one of the biggest, most exciting innovations we saw was when somebody from the physical sciences said, I've got this amazing detection technology, cannot think what would ever use it for. And of course, the healthcare system is just full of opportunities to apply that sort of amazingly, exquisitely sensitive imaging stuff. And it was just a conversation between two people who don't normally talk. I'm just thinking back to the world-class track and trace system that we will have and during the pandemic. And what happened? There were technology companies that already had that, but we tried to go from scratch, and I don't think it worked. And I think this is the other opportunity. When there are really good systems developed by people outside of a pandemic or etiology or tracing, why don't we just use them? And we don't have to reinvent anything. These are just doors that can open really readily. There's not so much effort there. It's seeing the problem that another industry can provide a solution or a part of the solution for.
Thanks for that comment. Actually, that kind of reminds me, one of the questions I was going to ask is, if the panelists, if George Freeman, the science minister, was sat in the audience, what
not
would they
the
ask
science
for him to produce? But given the fact that's all gone out the window, I thought we'd forget that one. So as a final question, this is kind of like a bit provocative because it kind of almost sort of bookends, from Tim's presentation to start with. It's and it's probably provocative for Wael and Andy and maybe James, and that is Massachusetts and the two Californian clusters, San Francisco, San Diego, as Tim sort of showed, right, huge critical mass. I mean, they've been there for decades. Everybody who's anybody is there in those spaces. So I'm just sort of wondering, if we had sort of ambitious startups in the audience, why would they not want to go to Massachusetts, go to the other Cambridge, or go to San Francisco or San Diego, rather than sort of stay around here? So, why wouldn't you recommend, actually, go to the States?
Yeah.
Wow, I'll let you go, because obviously that's your day job.
Yeah. Actually, I would say, like, in terms of talent, and especially in life sciences talent, companies are consistently saying, like, London is the first in terms of life science talents. So, and larger companies always like prioritize the talents and skilled laborers over like the costings of like the rental cost and those other stuff where they relocate or things like that. So talents is one point. Like investment attraction in the area here is like huge. I know like it's in Massachusetts it's also big, but London is attractive. I would say also like there's like kind of cultural vibrancy and visitor appeal that makes London more attractive for those kind of companies. I would also say like London is like improving infrastructure and still like staging inspiring global events, and it is like a reach. It's rich not only in life sciences businesses, but it's rich in all like the high growth businesses and high value businesses. So it's kind of like encouraging environment. But if they want to Massachusetts, like that's not a bad decision. There's always like some advantages of each places.
Andy.
I would say, actually, in some cases, certainly in terms of capital, it's currently much easier to get the capital, and so it may well be that you need a US operation. Doesn't mean you don't have a UK operation as well. I think there is a question about, I deliberately didn't mention Oxford earlier, but there is a question about what a real life sciences cluster is, and I actually am not sure that Cambridge or Oxford or London are big enough to be a global life sciences cluster. If you're really going to compete, we have to think of that entire golden triangle as the cluster. Arguably, you go up to Manchester as well and have a diamond in the UK. The other thing I would say though is actually one of the things I hear frequently is that the quality of the underlying science is absolutely fantastic here, and when investors come and look at it may be more difficult to scale the business, and so you may need to go to the States to scale the business, but the quality of underlying science is absolutely outstanding. Cambridge, as a university, has over 120 people who have won Nobel Prizes affiliated with it. That's more than every other country in the world. The US as a whole is an exception to that, but it's more than France, it's more than Germany, etc. There is a fantastic science base that's here, and I would argue that rivals, in fact, is probably better in terms of fundamental science than many of those US places.
Yeah, and it's interesting the point you make about Cambridge. Does it have the critical mass? For years I've always just described it as the UK. I mean, obviously, most of it sort of gravitates to the sort of the golden triangle of Oxford, Cambridge, London. So I take your point. So. Tim, because he's going to have the bishop's crook put me off, I'm going to sort of like leave the last.
Andy took my answer.
Yeah.
Sorry.
No, that was a great answer.
So what?
sorry.
I mean, do you want to sort of say why you think this is the better Cambridge?
I'm kind of being funny, but I'm serious. I mean, Andy took my answer. I think he's absolutely right. You know, the bumping into people. It's some of it's though the type of science. If you're in Seattle, you might be working on immunology, so it's got a specific, core competency in that. And you touched on that. It depends on the sciences. But for a depth, for a range and a depth of science, it's Nobel Prizes. I think it's you could stop and end with that, and the fact that you have this urbanization of cluster when you bump into people, and then plus you've got if we take the macro environment, you've got a very supportive regulatory and government environment here. And you have a campus like Abraham that Derek runs. This is really a special place. You don't see this type of campus to this type of scale anywhere in the world. And I'm not just saying that because Derek and I talk a lot, but it really is unique. Somebody may start an incubator in a building or one of the buildings that Alex is running or Colleen's trying to lease. But a campus that's dedicated to this, and the success is Derek's got people who need more space. This is a key component. And at a conference like this, Biocom, tries to do stuff. Mass Bio. This is a pretty special place. This is a very, very unique ecosystem in the world. And I'll go back, Andy. Again, I'm going to end right there. Nobel Prizes.
So I think that's an excellent point to finish on. So I'd like you to thank the panelists for their contribution. And I'm going to hand over to the gardener.
Thank you, Mike. Thanks to the panel. I think the whole day for me it's been thought-provoking, it's been informative. Sat there all day, it's just made me think about actually who are these other stakeholders I've never really thought about or know how to engage them. And I think the theme on here has always been about translational research. I think what I've heard recurrently is there's all sorts of translations. Some of it's terminology between sectors. Some of it's just perception. Like farmers aren't innovative. I can see now why you wanted to stand over here, not sit next to it. But coming back to the gardening stuff, having grown up as a farmer's boy in Wales, I kind of feel like I've gone full circle back to gardening now. So with that, I've just got some thanks to all of our speakers, the panelists and the moderators, sponsors. Obviously, that makes us able to deliver this along with the delegates and your engagement. One Nucleus is very lucky to be sort of custodians of a fantastic network of innovators, and innovators of every walk and size and sort of business, professional services right the way through to pharma. And so we're just very lucky to have that network to come to do things like this and have these sorts of conferences that Tim talks about. So thank you to all of you. And thank you to John Green and the board, because otherwise we wouldn't be here at all without their steer. And to the One Nucleus team. Someone once said, oh, you the nucleolus of One Nucleus, now you're chief exec. And I thought, well, that sounds quite good, until you look up and it says, small round body of no known function. So, because it is really, it's the rest of the team that isn't stood up here. Actually, it does most of the hard work behind the scenes and makes these things happen. So thank you all. Drinks are served downstairs on the ground floor. Thanks for